I'm Esther Kim. I'm a neurosurgeon at Loma Linda University Health in Southern California. And thank you for joining us today. As you know, these are unprecedented times and we've all had to change our practice to provide the best care for our patients. And I'd like to thank Dr. Yu and all the program chairs for this invitation to speak. Okay. So I have no conflicts of interest to disclose, and I'll just be kind of making a few comments and an overview about the effect of COVID-19 on academic practice, specifically a little bit about policy, fiscal impact, practice impact, specifically at our institution at Loma Linda, and the training impact, especially at an academic practice. That's kind of our MO, is training residents and future clinicians. So this is just a short little condensed timeline. In December, you know, as we all know, China reported the cluster of pneumonia in Wuhan, and then Chinese officials confirmed of the novel coronavirus. The first confirmed case in the United States was in the state of Washington in Snohomish County in January. From a policy perspective, the American College of Surgeons recommended health systems should, quote unquote, thoughtfully review all scheduled elective procedures in mid-March. And then soon after, the US Surgeon General recommended halting elective procedures. In the state of California, the governor issued stay-at-home orders soon after that. In about mid-April, the American College of Surgeons recommended reviewing 10 distinct issues prior to any elective surgeries to be safely reinstated. So from a fiscal point of view, the American Hospital Association has estimated that hospitals will lose approximately $202.6 billion due to COVID-19. A lot of this has to do with the changes in hospitalization rates, specifically reduction in things that we routinely see, like heart attacks, strokes, and even trauma. There's been during about April, there was an 80% reduction of motor vehicle accidents coming into the hospital. And then with the cancellation of surgeries, as mentioned previously, that has been the bulk of the loss of revenue for our hospitals. And then some additional costs, such as purchasing PPE, along with additional staff support. So on a personal note, many of us have been fiscally impacted, as noted on our survey. 78% of people reported that they've been impacted. 266 hospitals at the minimum have furloughed workers in response to COVID-19. These are just a couple of different academic programs that have had to furlough or cut pay, and some of the estimated losses. Mayo estimating about a $3 billion loss, Ohio State probably over 300 million revenue loss, and Mass Gen 1.6 billion in just the second quarter alone. So from a practice standpoint, 96% of respondents reported that their practice has changed. And the luxury of being in an academic setting is that we have a diverse pool of people with multiple different specialties that are able to come together and develop local hospital policy changes. And so, some of the changes, as Yujung had even mentioned, is, changes in terms of having, have most of our staff work remotely at home when possible. And, and then there were staff that were also furloughed with forced vacation time or forced CME time to be taken, along with pay cuts. There was a quick adoption of telehealth services at our institution. We used a combination of Epic MyChart, Zoom, and Jabber, and this was both for outpatient services and some inpatient consults. As I mentioned, there was a reduction in stoppage of elective procedures, and we began starting that pretty soon after. Now, on the next slide.
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.